Today I'm going to show you how to use athletic tape and pre-wrap, some of the cheapest materials you can get, to wrap your medial meniscus injury with an unstable knee. Stay tuned. Now we're going to use some standard athletic tape. I don't love this stuff, but it does work in a pinch. And we're going to use some coverall so we don't tear her skin up. But basically what happens with this is it provides a little bit of movement check, we call it. So we're actually going to just form like an X on this side, and so we're going to restrict movement in, you went with me there, in this direction. Like if I was driving across there, we're decreasing the amount of gap in the joint space right there. So let's see, lift up a little bit, make sure you're in camera. And just for the purposes of the video, I don't have any elasticon or elastic tape here with me. So I'm going to use some of this white tape as the anchors. I don't love to use it as the anchor, mainly because these muscles in the area, when she moves her leg and contracts, it's going to bust them open, or it's going to impinge on some of her, I guess, her muscles' ability to move. So that's not really a good thing. So here's what we're going to do first. We're going to set our anchors. And again, with the taping thing, if there's an ACT out there, I want you to comment in on this and tell me I suck. Because ACTs are really good at doing this stuff. So I don't do them quite as often, but it works when it works. Okay, so we have our two anchors right here. Again, I wouldn't typically use this white tape here. I want something a little bit more elastic so her muscles can expand in there. So now what we have to do is we have to provide the check right here. So I'm looking for about this length. Okay, so I'm going to make 3 of these, and we're going to make a star formation, or an X rather. Funny when you got to do this in a camera, and usually just go walk away and do it. Okay, so now we got the X right here. Okay, we'll stick this thing down, and for the most part, we want to see if it's irritated or unstable this direction. We want to make sure that we tape it pretty firm in the other, or in a position where it's comfortable. So in this case, she has her pain right into, where'd it go? Right into here. So I'm going to cover this area up. And actually, I probably should have done the X a little bit lower. But you can always do a secondary one as well. So this is basically blocking this motion going this way. Okay? And again, we can add some more. If I wanted to, I can go this way. And add another one this way if I wanted to. But, so here's what's going to happen from here. I know this looks super ugly, and it seems like it's not going to stay, but realistically, they usually do. So you can provide another anchor. Here, and then fold these things over, is basically what ends up happening. And then afterwards, you can cover these things up. I'm still on camera here. Good. About to use a whole row of tape on you.
Those muscular legs.
Of course, it's the muscular legs. Yeah. If anyone thinks that Laura has muscular legs, I want you to say so on the video, on the comments below. If not, I want you to tell her she's full of it. Okay. So this is taping to stabilize, and let's turn a little bit here. So we still have all this wrap here. Typically you take like a whole cover and just wrap this thing up so it doesn't shred apart when she's actually moving. But this is going to basically take the place of doing a knee brace, but in reality you could probably just buy a brace too. Wait, say that again. Say that again so all the people listening, they're like, oh, that's a terrible job. I want you to...
What? My fat looks like it's poking out?
No. So it feels stable is what we're looking for.
Yeah.
Okay. So,
that's what you're talking about.
So all we want is to see that it feels stable. And realistically, we should probably check we check capillary refill as well. So you have to check to make sure that all the vessels down to the toes are working when we haven't obstructed anything. But yeah, you usually want to use a stretchy tape around that area.